Dr. Best, and he was just a phenomenal lifelong mentor to me. I wouldn't be where I'm at today if it wasn't for his guidance and his belief in me. And I'm happy to share that. I think it's been a couple years now that I led efforts for Dr. Best to become a honorary member of our tribe, Turtle Mountain Band of Chippewa. So, so now everybody's calling him cousin. And got it? Okay. So I'm going to be talking to you about the Indigenous Health PhD program at the University of North Dakota. We launched this in 2020, and I am one of the co-founders along with Dr. Don Warren. He's the one who got all the buy-in, pulled a team together to launch the program that we envisioned, and it, like I said, launched in 2020. Department of Indigenous Health launched in 2021, and so I'm just going to share a quick snapshot of this doctoral program, the first of its kind in the world, with you. Next slide. So Indigenous knowledge and culture have historically been excluded and considered irrelevant in the scientific enterprise. And so we really seen this as a gap, and we targeted the working professional. And the idea behind it was to, we knew a lot of people were doing the good work in tribal communities and wanted to get their doctorate, but maybe just didn't have the means to move to a university and do it on campus. And we kind of hit the perfect storm, really, because we launched during COVID and everybody was scrambling to get online, and that was our model because we were targeting the working professional, and we just come flying out of the gates. And our approach to this was a two-eyed seeing approach, so we blended Western methodologies with Indigenous methodologies throughout our curriculum, and then we also have classes that are focused specifically on Indigenous methodologies. Next slide. So our vision is to improve the health and wellness of Indigenous peoples, and we are empowered by Indigenous knowledges and cultures, and we envision a world in which the current and future generations of Indigenous peoples thrive with equitable access to health and wellness available to all. Next slide. And our value system includes integrity, humility, compassion, respect, and wisdom. And our team did a lot of work to create these values along with our students that were part of that process at that time. Next slide. I'm going to touch briefly on our curriculum. Next slide. And so our PhD is accredited through UND's regional accreditation by the Higher Education or Higher Learning Commission. And our next reaffirmation of accreditation is in 2033-34. And so interestingly enough, because we're really a public health, Indigenous health focused program, but we decided not to go under that accreditation because it was limiting, since we were bringing in the Indigenous methodologies, and we did not want that. We wanted to honor that space for bringing those methodologies into the academy. Next slide. So there are 45 learning outcomes organized into 9 categories. We cover cultural safety and humility, community engagement and partnership, community-based participatory frameworks, community development, leadership and ethics, health equity and diversity, practice-based, evidence-based approaches to public health, evaluation strategies, and policy development and advocacy. Next slide. So this is just a snapshot of our program. To date, we have matriculated 80, and we're a postmaster's program. We've matriculated 80 students, and then we have a class of 8 that are going to be starting this summer. And we have graduated 20 doctors, and you see 19 there, but unfortunately one of our students passed away, but we were able to work with the university to give him an honorary doctorate because he was working on his dissertation. And some of our product examples, so we really we honored the Western practice of like having your traditional designed dissertation model, where you could do the chapter style dissertation or the 3 scholarly articles. And then we also have an applied track where you also have to have a scholarly article, but you can have a portfolio that includes community products that actually benefit the community. So that might be a grant proposal, an evaluation report, a facilitation guide, a policy brief. And so that really opened the doors for a new model in academia. And there's been other programs at the university now that are asking us for our model because they want to have practice-based academics to where these products can be moved, are relevant now and can be moved directly and put into action into communities. Next slide. So I'm going to touch a little bit about our program. Next slide. And this is just a breakdown of those 80 students, and on average we've had 4 inquiries per week, and our admission rate up to this point was 59% over the entirety of the program. We've had a 95% retention rate, which is just phenomenal. And I hunt everybody down and I'm like, where are you at? Why aren't you enrolled? So we really just try to keep a high level of engagement. And this year, our admission rate got very competitive because now we're at a point to where we're just maintaining. And so our incoming class is going to be determined by how many people we graduate. And so we ended up admitting 8 this time, but now the next class will be determined by how many doctors we have walk this summer. And so we're trying to maintain a steady level of 60. And this year we reviewed 38 applications and we were able to admit 8. Next slide. And this just shows the enrollment over time. You can see how it's grown since we first launched. Next slide. And this is kind of a fun slide. It shows the age categories for our enrolled students. So we have the young folks in our program, and we have, grandpas and grandmas in our program, the aunties, uncles, and so very, very diverse in age. And we also have students that across Turtle Island and Hawaii, Pacific Islands representation, and so very diverse class. Next slide. The majority of our students are Indigenous, and the majority of our students are Native, and the minority is white. So I venture to say that we're probably one of the first doctoral programs that have these kind of statistics, and so we're very thankful. Next slide. And so Dr. Wilson, we were very fortunate that we were able to recruit him and have him join our team and lead our efforts. And so he's our chair, the keynote from today. And then we have 8 dedicated faculty and staff who are motivated to support students in the Department of Indigenous Health. And here's all of our faculty here. Next slide. And here's their roles. So we have, Dave Wilson, Navajo, myself. I'm from Turtle Mountain Band of Chippewa Indians. Grace Karkari, Santa Gana, Dr. Joel Steele, Sisseton, Wahpeton, Oyate, and Fort Peck Tribes. Dr. Andrew Williams, an ally. Dr. Bryn Luger, Standing Rock Sioux Tribe. Dr. Terry Wabanaskam, Oneida Nation of Wisconsin. And Dr. Chandra Schrader, an ally. Next slide. And this is some of our staff that also support us in our efforts. And so, I have Dr. Williams there again. Sorry about that. Malachi Tamang, then Rosalie Martin, who's in the back here, her and I work closely together. Turtle Mountain Band of Chippewa, she's my program manager for an AHEC NARCH initiative that I oversee. Courtney Davis, Turtle Mountain Band of Chippewa, and then Darcy at Pingree. Next slide. And then here's a snapshot of student and alumni achievements. And so these are our first 4 graduates. Next slide. Oh, you got it up. Sorry, previous slide. Thank you, sorry about that. Dr. Danya Carroll, Dr. Cole Alec, Dr. Amy Stiffarm, and Dr. Mona Safonte. So that was a very happy day. In our model, we're online and we're asynchronous distance, but we have a week on site where we have a lot of cultural programming, and then at the end of that week, our first year and our second year students, because there's 2 summer in-person sessions of seminar, we break early on that Friday, and then we walk over and we watch the graduates. And so everybody, regardless of when they finish, they walk in the summer, and so it's just really powerful, and we really have a good, solid model to support our students. Next slide. Now, and how am I doing on time? Okay, good. Doing good. Dr. Cole Alec, he is from Turtle Mountain down to Chippewa Indians, and he focused on Indigenous long-term supports services, elders, traditional knowledge, and tree rings. And so he created his own framework and applied that. And he looked at perceptions of cognitive decline among American Indian Alaska Native elders, a quantitative study. We do qualitative, quantitative, mixed methods, and so our program is really focused on looking at Western and Indigenous methodology, not so much the outcome, but really building our capacity around data, data sovereignty, and giving our scholars the tools that they need to apply to their toolkit to any problem. And so here I'm just trying to get across that like there's a lot of different things that our students do, so they're very diverse in their areas of expertise as well. Next slide. And this is Dr. Heather Medicine Bear, and she's currently serving as faculty over at the University of Hawaii, but she did it. This is her defense on encompassing Himdak, Indigenous ways of life to address cardiometabolic disease in American Indians, Alaska Natives through research, policy, and action, interventions for cardiometabolic health in American Indian, Alaska Native communities, a scoping review, and then she also did a patient navigation for cardiometabolic disease in tribal health systems, policy, strategies, community survey findings, and recommendations. And then she created a toolkit, developing a strategic plan to improve cardiometabolic health in communities. Next slide. This is Dr. Adrienne Rickers, and she did a grant application to Montana Healthcare Foundation, Fort Peck Tribal Health Dental Department Evaluation Plan, and then she wrote a manuscript focused on utilizing the Indian Self-Determination Act to enhance and improve health outcomes in tribal communities. Next slide. Dr. Lynn Madsen, she did applied Indigenous knowledge translation, measuring wellness through Indigenous partnerships, a scoping review. She also created a listening session, facilitation guide for tribes that focused on protocols and practices and facilitating those conversations. And then she did an evaluation report on a virtual Indigenous Data Science Academy that we created at the university as well. Next slide. Dr. Andrea Begay, she did strengthening the health and well-being of American Indian Alaska Native elders, and so she really took a deep dive and did a traditional style dissertation, just understanding some of the things that were impacting elders and the role of traditional food around consumption, associations between multi-generational housing and mental health and wellness among American Indian Alaska Natives, and the relationship between brain health and oral health. Next slide. So a few slides just saying where they are now. So Dr. Polalic, he's an assistant professor of public health at Washington State University, and then he plays a couple other roles as well. Dr. Amy Stiffarm, she's the director of Native American Initiatives, Healthy Mothers, Healthy Babies, the Montana Coalition. Dr. Danya Carroll, postdoctoral associate in epidemiology and biostats at Schule of Medicine and Dentistry at Western University. Dr. Vaha Tofano, Executive Director and Principal Investigator of American Samoa Community Cancer Coalition. Next slide. Dr. Jacob Taylor is the Executive Director, National Indigenous Economic Prosperity Institute, First Nations, University of Canada. Dr. Cameron Smith, Apache Behavioral Health Services, White Mountain Apache Tribe. Dr. Jennifer Wuss, the Director of Native American Student Success, Denver Public Schools, owner and founder of Project Mosaic. And Dr. Sharice Holidays, the Chief of Nutrition Services, Indian Health Services, University of Arizona. Dr. Courtney Clausen, Research Associate for the Great Plains Together Overcoming Diabetes Project, Johns Hopkins Bloomberg School of Public Health. Next slide. Okay. Dr. Mona Savante, Winnebago Chief Public Health Officer. Dr. Adrienne Ricker, Adjunct Department of Indigenous Health. Dr. Wyatt Whiteboat, faculty, McKellen Institute School of Public Health, and program specialist with Indian Health Service, National Community Health Aid Program. Dr. Stephen Weitz, the Director of Research, Kaufman Associates. Dr. Lynn Madflin is the Research Program Manager at Johns Hopkins School of Public Health. Next slide. Dr. Paula Aubrey, she actually just got a new position, but she was the Food Sovereignty Program Manager with her tribe. Dr. Heather Medicine Bear, Assistant Professor and Program Manager, Hawaii Pacific University. Dr. Andrea Begay, Senior Research Coordinator, Northern Arizona University. Dr. Darcy Merchant, Indian Health Service Area Division Director. And Dr. Tara Stiller, owner of Alaska Indigenous Healing and Prevention. And she is also just got a tenure line as an assistant professor in Alaska, at the University of Alaska. Next slide. That's it. Thank you. Butch.